PAT stands for Pre-Anesthesia. It's a team that includes nurses, nurse practitioners like myself, and also our anesthesiologists. Our goal is to collect a health history that'll provide useful information for our team to deliver anesthesia to you in a safe manner. Every patient that's going to be undergoing a procedure here at Geisinger with anesthesia will be assigned a risk score. That risk score is calculated based off your past medical history, as well as the risk of the procedure that you're undergoing. Based off that score, the lower scores will receive a more virtual pass through our clinic where we will contact you via my chart. A moderate score will be contacted via telephone calls with one of our nursing personnel. And a higher risk score will come into an in-person visit here in clinic that will be scheduled for you. You'll meet with myself or one of our nursing personnel. During this visit, we're going to do an assessment and we're going to collect your health history. With that information, we'll also give you some pointers of what to expect for the procedure, what to expect from the anesthesia, and most importantly, what you need to do to prepare for that procedure, usually the evening before and the morning of. We do ask that all patients hold any vitamins, herbal supplements, green and herbal teas for the 10 days preceding surgery. For that 10 days before surgery, we want you to avoid those medicines because they could potentially interact with our anesthetic agents. So we want to reduce your risk for the procedure by having you avoid those substances. In addition to that, we do also ask that you avoid any sort of other chemical substances like alcohol, cannabis, or marijuana, as well as any other unlisted medications that you don't have on your medication list. We'll be sure to review this medication list with you as part of your PAT encounter. So we do have several agents that we'd ask that you hold several days prior to surgery because they can really complicate matters here for our anesthesia team. Some of those agents would be our GLP-1 agonists. A lot of people are using these for weight loss these days, but they can really slow down your gastric emptying time, meaning that it takes longer for food to empty out of your stomach. This can increase your risk for post-operative nausea and vomiting, and because of that, it can also increase your risk to aspirate, which would mean that stomach contents would come up into your lungs, potentially causing a pneumonia, which can be very dangerous for you. Other medications that we hold multiple days prior to surgery would include an SGLT2 inhibitor. These medications are oftentimes used for heart failure or diabetes more commonly. These medications can actually cause a strange reaction in your body where your body switches over to breakdown of ketones as opposed to general metabolism, which can cause a state of acidosis or high acid in the blood, which can again be very dangerous for us. So we want you to hold these medications several days beforehand. Our PAT team will instruct you when to stop these agents. This may be a sensitive topic, but if you have any previous addictions to substances or alcohol, it's important for our anesthesia team to be aware of that, as it can help us guide our plan. We do ask that for the 24 hours prior to surgery that you avoid any use of alcohol, tobacco, chewing tobacco, medical marijuana or cannabis, as well as any other substances for that 24-hour period.